Welcome to NeuroNights. My name is Kadar Hiremath, and we are talking today about lifestyle medicine. So we have two of our guests, Kim Tartaglia and Glenn Westphal, who are physicians here at Ohio State's Wexner Medical Center. So Glenn, Kim, thank you for joining us today. Let's get to know a little bit more about lifestyle medicine, what that means for general practice as well as for brain injury survivors, and what the general public needs to know.
Of course.
So let's learn a little bit about you. So if you can tell us about your roles and then maybe a little bit about your training. So Glenn, we'll start with you.
Sure. So my name's Glenn Westphal. I'm a assistant professor in internal medicine at Ohio State. I'm a hospitalist by training, so that means I spend most of my days caring for people with acute hospitalizations, often at moments when their chronic disease is decompensated. So I see a lot of patients with multiple chronic diseases. They take a lot of medications, and at times they're dealing with the downstream consequences of their day-to-day routines over many years. And I kept noticing if we could help people change those habits earlier, maybe some of these complications or hospitalizations and even chronic diseases might be prevented or reversed. So that's kind of how I ended up looking into lifestyle medicine and engaging with lifestyle medicine. And I also, it was a little bit of a personal journey as well. In my early 30s, I started having kids. I went to the doctor, had high cholesterol and borderline high blood pressure, and really wanted to change my life, but didn't really have a good context or way to do that. And lifestyle medicine gave me an avenue. In some ways, I was kind of my own first patient for lifestyle medicine. And I think that's a common thing we hear about in lifestyle medicine training. And so, yeah, that's me. And that's kind of how I ended up in lifestyle medicine. There's a certification process you go through, and a lot of CME and joining or attending the conference. And I'm happy to be here. So thanks for having us.
Yeah, great. From what I gather so far, that this is something that anybody deals with, right? Mm-hmm. You could be in a chronic condition or in an acute care setting, but it's lifestyle, right? We all have that in part of our lives. Kim, what about yourself?
Yeah, so I've been at Ohio State for about 18 years. I'm also a hospital-based physician trained in internal medicine and pediatrics. So I spent the early part of my career taking care of acutely sick children at Nationwide Children's and then adults here at OSU, and very deeply involved in undergraduate medical education. But as I saw our patients come in sicker and leave sicker, mostly with chronic conditions that were exacerbated or putting them at risk for, their hospitalization, I too sort of thought, well, what can we do? And so kind of finding lifestyle medicine as a specialty and figuring out what is the training and certification process. I first got trained in health and wellness coaching to be better at, motivational interviewing and talking to my patients about behavior change, and then completed the lifestyle medicine certification. To the point where, as we'll talk later, I think figuring out where we can embed lifestyle medicine, and as hospital-based physicians, what better place than while you're in the acute care setting, while you're, motivated to potentially change your life because you have a new diagnosis or a flare-up of a chronic condition. And so figured out how to develop a lifestyle medicine consult service. And so I split my time between traditional hospital-based medicine and lifestyle medicine.
Well, and, this idea of splitting your time, right, I think that's where I started thinking about, the idea of lifestyle medicine being really interesting, because in some sense you could think about this allopathic, very Western medicine-oriented model, medicine, hospital care, and the things that you kind of typically see. And then, there's Eastern cultures, of course, that take different approaches. And then certainly this idea of just wellness, of putting in those good practices. And sometimes they come across as combating each other in some sense. Do you see it similarly in that, you're really still practicing what a person might need for a chronic condition or an acute issue, but then you're also really bringing in these sort of, wellness-oriented practices?
I'm happy to answer that. So I think it might be helpful to define lifestyle medicine.
Yeah.
And I'd start by giving sort of a general feeling for it. It's really about helping patients harness their daily habits and, what they eat, how they move, how they sleep, their day-to-day habits really as powerful forms of prevention and treatment. And the definition from the American College of Lifestyle Medicine is that it's a medical specialty that applies therapeutic lifestyle interventions to treat, reverse, or prevent chronic conditions like cardiovascular disease, type 2 diabetes, and obesity. And we do this using the 6 pillars of lifestyle medicine, which are interconnected pillars. There are certainly areas from Eastern practices like meditation or mindfulness, or some, quote unquote wellness space things that can fit into those pillars. But lifestyle medicine, when we use that term, is very evidence-based medical specialty. So we're looking at where's the evidence for these lifestyle interventions. So the 6 pillars are optimal nutrition, physical activity, restorative sleep, stress management, connectedness, and avoidance of risky substances. And when we talk about optimal nutrition, we're really focusing on minimally processed, plant-predominant, nutrient-dense meals and snacks. Physical activity, we are really talking about getting movement in every day, aerobic activity, strength training, and then for certain people, flexibility. Restorative sleep, so creating the right conditions to get 7 to 9 hours of sleep. Stress management, developing healthy coping skills to meet the everyday demands of life. Certainly that's an area where things like meditation, yoga can certainly help. And then connectedness, fostering supportive relationships, building connections through other people. You hear a lot about the loneliness pandemic these days. And there's real data out there that if you're lonely, you don't have good connections either through volunteer organizations or family or friends, those are really high risk for these chronic diseases getting worse. And then the last one is avoidance of risky substances. So avoiding or decreasing use of things like alcohol and certainly tobacco products and things like that. And it really borrows a lot from multiple disciplines. So your question is excellent. Things like nutrition science, positive psychology, behavior change, health and wellness coaching. I would add that I think it's helpful to make a distinction between things like lifestyle medicine and then these other specialties like integrative medicine or functional medicine, because they do get sort of lumped together in this quote-unquote wellness space.
Makes sense.
Integrative medicine typically focuses on incorporating evidence-based complementary therapies like acupuncture, yoga, massage, mindfulness, along with conventional care. And then functional medicine often emphasizes individual testing, targeted supplementation to explore the root cause. So there's absolutely overlap. Different practices, different clinicians may draw from different frameworks, but I think the key distinction is kind of where that center of gravity is for the care. And in lifestyle medicine, it really is anchored in behavior change and kind of working with the habits of the patient.
It's diet, sleep, exercise, right? We all know that we have to do better with those things. And then you're kind of taking more of a scientific or evidence-based approach to optimize how we do that. Kim, what do you think?
Yeah, what I'll add is that, if you look at the American Heart Association for the best guidelines around heart disease, or the American College of Surgeons for the brain-injured patient, they all talk about lifestyle, physical activity, the importance of it, of nutrition, of stress management, and sleep. I think the tension comes is how do we behave in the patient room? And knowing that, behavior change is hard and it takes time to educate our patients, educate ourselves on this. Do we have places to refer patients to? That's where the tension comes in. And so sometimes, even when I'm serving as a hospitalist physician, and I know lifestyle is at the foundation of treating my patient, the question is well, if I've got to order these procedures for them and I've got to order these medications for them and talk to them about that, where is the time to talk about lifestyle medicine and not just give it lip service? So I think the evidence we agree on. It's just how do we implement this so that it's actually beneficial and impactful for patients?
I guess, I'm looking at it as the tension between the system, right, of care as opposed to the intent of the physician. So how do you get around that? I think, obviously you in this field, you have specific training for it. How do you actually implement that in your day-to-day?
So for me, as I've gotten into lifestyle medicine and really trying to incorporate it in my day-to-day, it shows up with most of my patients. I ask them, what are your habits? How are you sleeping? How are you, what is your diet like? Then there's certain patients that really seem to be in that action stage. We talk about pre-contemplation, contemplation, and then there's certain patients that are ready to take action on their lifestyle. And I think that an acute illness, being admitted to the hospital for some patients is sort of like a sentinel event. Things like a stroke or an accident where they recognize that they need to or want to make a change in their life, and using that opportunity to discuss lifestyle changes. And then here at Ohio State, we're trying to build, outpatient referral systems for patients to take that burden off of the primary care doctor or the neurologist that they're seeing, to get places where people can be referred for true lifestyle medicine interventions and behavior change.
So, in terms of awareness of lifestyle medicine, you both came to it for your own personal reasons, right? What's the job here? How do we get this this language into people's lexicon and make providers more aware that this exists? I mean, is that a challenge still?
Yeah, and I think for me, going through the training, one of the eye-opening things was actually looking at some of the landmark studies that really started this movement. I think you're exactly right. We're sort of repurposing old wisdom and known things with a new scientific rigor. So, American College of Lifestyle Medicine was founded as a professional society in like the early 2000s, 2004 or so. It was really kickstarted by some landmark studies back in the 1990s that looked at heart disease, diabetes, and hypertension. So the first one that I'll talk about is called the Lifestyle Heart Trial by Dean Ornish. That was a pretty intensive lifestyle medicine intervention that used whole food, plant-predominant diet, physical activity, stress management, and social connection in a very controlled setting. And they actually did angiograms. So they looked at the plaque in people's hearts, and they showed regression of their plaques. So people had blockages in their hearts that got better with just lifestyle interventions. And for me, as a practicing physician who had gone through medical school, gone through residency, that was the first time I had heard of that. And so that was something for me that was very eye-opening going through the training. That exercise is good for you and that eating healthy is good for you, but seeing the evidence that it could be used as an actual treatment was something that really got me excited about lifestyle medicine. I think that the second study was the diabetes prevention program in 2002. That was a study that was similarly looked at people high risk for diabetes. It found that lifestyle interventions, so diet plus 150 minutes of exercise per week, reduced progression to diabetes by 58%, and was actually more effective than metformin. Again, these patients were in a study, so they had some help along the way and things like that. But there's certainly a time and a place for medication, so I'm not trying to advocate for not using those. But this proves that we can actually use lifestyle interventions to treat and prevent and sometimes reverse chronic diseases. Then the last one is the DASH diet, and I think a lot of people have heard of the DASH diet. But even that gets misconstrued in physician discussions and things. It wasn't just about reducing salt. It was actually about adding fruits, veggies, low-fat foods. And that study goes through the physiology of why those things actually make a difference for lowering blood pressure in patients. And so I think a lot of it is education for our doctors and other providers. And sort of like Kim alluded to, trying to advocate for the time to have these discussions and at a broader scale, the the payment models to figure out how to reimburse for this kind of work.
Sure.
That is really important, and that's, I think, a different conversation. But we were at the Lifestyle Medicine Conference recently, and that was one of the big topics was the finding the time for physicians to actually have these conversations, and then and also learn how to have these conversations. This was one of the I had heard about motivational interviewing before lifestyle medicine. I'd heard about positive psychology, but these are things we don't get a ton of training in medical school. And so, how do we help physicians learn these skills to actually create behavior change in patients that are interested?
Yeah, I mean, with anything new, right? You're kind of pushing the bounds of the box that you might be working in. Yeah. It's interesting to hear about the motivational interviewing piece of it. I mean, maybe let's talk a little bit more about that, because I think you talk to most patients, certainly brain injury patients. They feel like they don't have enough time, that there's not this constructive back and forth conversation with a provider. And some of that is a little bit stereotyped. To be sure, but they're common complaints, and you have a lot of education to do. It's not so simple to say, well, sleep better, right? And so, there's a lot of strategizing and certainly personalization that you may be doing. How do those conversations go when you're using motivational interviewing practice? And are patients receptive to it right off the bat, or do you feel like you have some convincing to do?
So, when we think about motivational interviewing, one of the questions I come to with my patients is, what's important to you? What would you like to get back to after you recover from this surgery, or after you get past this acute phase of your brain injury? What are you looking forward to? So provide them some optimism that they can get back there. It's not just avoiding complications or progression of disease, but we're actually trying to help them restore health if they want to. So are you, curious about this? Are you curious how you can be empowered to be an agent of change alongside with sort of everything else we're doing for you and with you? And if they are curious, that's a great time to say, okay, let's go through these pillars, and how are you doing in each of these? Where are you motivated to change? Where are you curious to change? And then how can I help you? Whether that's additional resources, creating an action plan, kind of doing that coaching mindset. We're trying to get them one step closer to being ready for that preparation and action phase of change. And then also just, who's your accountability partner? How are you going to know what's working? When are we going to check in to see how things are working? Because there is a lot of experimenting, and there's not one size fits all, whether you're talking about diet or the best exercise or the way to reduce stress or improve sleep. So we do need to check in fairly frequently. And so saying, I'm here on this journey with you, and I want you to have someone, who can help, again, keep you accountable besides me, perhaps, but doing things that you love, and you're walking towards something. And so less about restricting things you can't do or that you have to avoid, and more about what are you walking towards.
You said you're kind of fine-tuning along the way with a lot of back and forth. And I think within that, you have those 6 pillars. Do you do all 6 at the same time? Do you do one at a time? I mean, how do you approach all that?
Yeah, I think typically, no, you would not approach all 6 and try to make big changes. I think a general, at least for me, starting small is a big thing. You don't want to throw too many things at a patient at once. I think, like, as Kim alluded, asking people what interests them and what changes do they want to make. And from a brain injury standpoint, whether that's like stroke or traumatic brain injuries, I think there's a few different ways to think about it. You could think about it from a pillars, and just going pillar by pillar, like what changes can we make? You could think about it from the symptoms. Are your symptoms more cognitive, headaches, fatigue, depression, struggling with your other chronic diseases, or from a timing standpoint, did this accident just happen? Are you in sort of more of a post-acute phase, or are we really talking about long-term survivorship? And I think those frameworks lend themselves to kind of slightly different discussions. I think for this conversation, where lifestyle medicine fits in is really in that, acute phase, using it as sort of like that sentinel event to, gauge where a patient's at. But then over the long term, it really is working with the 6 pillars, recognizing that small change is better than big change. They're going to compound on each other over time. The better you sleep, the better your regulation of your appetite is going to be, and the less stressed you're going to feel. And then you may find that you have a little bit more time to get a touch of exercise in over time. So frequent check-ins and small changes are better than big changes, I think, would be what I would highlight with patients. I don't know if Kim has anything else to add.
Yeah, when I'm doing my lifestyle medicine visits, I'm often going to assess and check in on each of the 6 pillars because, if I had my health coach hat on, I would be saying, like, whatever you want to work on, let's create a plan for that. But as a clinician, I'm going to use my diagnostic reasoning and think about their comorbid conditions to also help them prioritize. So if sleep is the main thing that is, making it so they can't make good decisions with their diet, they have no energy to exercise, their mood is terrible, then I might chime in that we really need to get that sleep study to see if sleep disordered breathing is playing into the fact that you don't feel rested when you wake up at night. So we'll co-create a plan together. And, more and more studies are coming out, whether it's talking about the brain injured patient or sort of the population at large. Small changes in multiple domains is actually better than getting your diet perfect or getting exercise on track. And so, we're not going to make 5 sort of goals in one visit, but we are going to work towards, moving you along that lever of, how can they really work together and be synergistic in improving your motivation, improving your health, helping you make progress, whether it's your metabolic disease, your mood, your cognitive functioning. But yeah, so start where they are, but also then, interleave that with our clinical expertise.
Yeah, I mean, in many ways, like I could say, okay, I saw this TikTok that said I should sleep better and use this tool or something like that. And I try to put that in practice on my own. And there's a lot of challenges to it. And also, there's so many things that you could change for the better. Which one do I start with? And you're really thinking about, if I make that change, well, how come I'm not doing this other one? And so then that's a stressor, right? So I like this idea of, having that guide to help you along. So we touched a little bit on brain injury as we went through this. Certainly there's going to be that traumatic, or either you're going to have the traumatic injury or you're going to have a stroke or something like that. But there's that, as you said, sentinel event. And then you have sort of step downs and things are changing and maybe even locations are changing or environments are changing. And then you have more that life after injury. Is it ever too late to start lifestyle medicine, I guess is the question that I have here. And if it's not going to happen in the hospital, can you do this at home?
So to answer the first question, no, it's never too late to start lifestyle medicine. There are plenty of things that patients can start doing home on their own. Like we said, in an ideal world, this is guided by a clinician or a health coach. If we're talking about exercise, then there's exercise physiologists or physical therapists. But very simple things such as adding 1 serving of leafy greens to a week, or trying to get 10 minutes of walking a day and starting there, or, if you want to work on sleep, having a consistent bedtime, and making sure, that you get up and get some sunlight in the morning to reset your circadian rhythm. Really small changes like that can, I think, give people a sense of ownership and really help boost their healing, kind of wherever they're at. And then finding, a lifestyle medicine provider to help kind of keep moving towards healthy habits in the long run would be helpful.
There's a Chinese proverb that says the best time to plant a tree was 20 years ago. The second best time is today. And so I think that's a mantra for lifestyle medicine. even when they've looked at studies, implementing lifestyle medicine practices at the age of 65 or later, you can get an additional 2 years of life if you start meeting these exercise goals, these nutrition goals, managing your stress. And so, as Glenn said, it's really never too late. And we're ready to help you start sort of where you are and move forward there.
I mean, that's really cool to hear that, that late in life and you're still able to sort of improve longevity. I imagine the quality of your life as well. That goes hand in hand there. And talking about the 6 pillars, there's the ones that are obvious to me. And I think we kind of hear this more often than not, right? The diet, the sleep, the exercise. And certainly in the research that we do here as part of our group, we focus on those kinds of lifestyle modifications. But interconnectedness is really hard to, in my opinion, it's kind of a pickle because the accountability that you could have with, someone who's either a partner or a friend or somebody in your life that can kind of keep you moving towards these behavior changes is great. But if you're also struggling with that interconnectedness piece, how do you start that? How would you attack that for a given patient?
So I think, you're going to ask them, what is their social connection like? What is their who's around them? Is it family? Is it friends? And it doesn't have to be a certain number of people. I think the studies have shown even just 2 people that you trust that you could call in an emergency really improves your loneliness scores and your ability to feel like you have people in your life that support you. And truthfully, even at our recent lifestyle medicine conference, one of the presenters was talking about how she had just moved to a new town, didn't really know anyone there, but she has two animals that she really finds a lot of connection with. Mm-hmm. And for her, in this stage of change in her life, the animals were her sense of connection. And so I think it kind of depends on the people. There's a lot of things going on in the world that are cool programs. There's various volunteer opportunities or men's groups, women's groups, things like that, where just getting out and meeting people, the data shows is really good for us.
Yeah, I worry most about, let's say, the men who, are in the hospital and they live alone and they can't tell me who they reach on for support or what their purpose for living is. And so wherever you can try to find, community groups, we have a healthy community center where you can come and do free cooking classes and education classes and exercise classes. I think the support and the community, the people you meet and you'll stay in contact with is as important. Even those informal conversations we have with the barista at our coffee shop or people at the bank, we want, especially as you get older, for you to get out of the house and interact with people. I think the other part of this is with group visits, so shared medical visits that, again, our colleague Dr. McKinley does in lifestyle medicine. Part of the therapeutic value of learning about lifestyle medicine in a group is that you get to support each other. So you get to celebrate each other's wins and be there to offer support, advice, and connection. I think probably we'll never measure how important it is, but I think at the base we know it's really important.
The question that I keep coming back to with all this, okay, so these are still really hard challenges for people, right? I mean, we've known that diet and exercise and all these things are good for us. We know that social connectedness can make us feel well, but they are extenuating problems in our society. And so for a brain injury survivor, what would you focus on first, or what would you try to...
With the brain injured patient, sometimes motivation is a challenge. And so, one thing I go back to is you don't have to feel good to get going. You have to get going to give yourself a chance at feeling good. Mm-hmm. And really, whether we're talking about exercise or doing that uncomfortable thing of going out to meet somebody or put yourself in a social situation, sometimes you got to put it on your calendar and do it. Again, maybe that's a community group at the library. Maybe that's your local rec center, Silver Sneakers. Maybe it's online if that's where you can find a support group. There is this program called Full Plate Living that I often refer my patients to. It's completely completely free. There's a bunch of online modules that'll help you with kind of the nutritional knowledge. But what they also have is a community. And I love when I see patients join. It's a Facebook community that I often see them in. And they say, my doctor recommended me here. And it's such a supportive community. So it's not the best sort of connectedness intervention, but it is something. And so if that's what you've got available to you, start there. And then, put yourself a little bit outside the comfort zone to take that next step to connect with others. And then again, if you can't drive, can you walk? Can you do virtual? That's really what we're there to sort of troubleshoot with patients. What are you willing to do? And how can we help you get there and remove those barriers?
Well, I think the troubleshooting piece of it is really critical, because if we get that sort of order of, we got to do this, it's just a complex diagnosis, and no brain injury survivor is the same. You're already taking more of a personalized approach, so it does fit well. But this idea of you have to take the leap of faith, but here are means and mechanisms that will work for you to make it less of a leap of faith and more likely to work for you, and you can kind of see the reward is there. You're working largely with adults, is that right? Okay, and Kim, you're working. At least you have been working with children in the past. Are there differences in how you would approach lifestyle medicine for a child versus an adult? Different lifestyles.
Yeah, absolutely. And I think Glenn, he's in the throes of early childhood parenting. But, when I'm working with families, and I do a lot of pro bono work with families about how to implement lifestyle medicine practices, things have to be a game and enjoyable for children. But so when it comes to nutrition, for example, getting them involved in cooking, if kids will sort of participate in the meal with you in planning, preparing the meal, they're much more likely to eat it. And that's been a great way for not only my own family and my own children, but also the families that I work with, to how do they get them to eat more like the lifestyle medicine plate, beautiful fruits and vegetables and beans and foods they haven't tried before. We also have to acknowledge that kids, their ability to taste bitter is much higher than adults. And most of us, when we don't like something, it's actually a lack of familiarity. So really that, try it multiple times, try it again, try it in various ways. If you can get your kids to stay curious, I think over time, their diet will expand the way you want it to. And then with movement, of course, movement is got to be play, right? We want kids to move 60 minutes a day, but it's got to be fun, playing, and we've got to make it enticing so that it's not, we're drawing them away from the video games. So how can you get them outside for fresh air every day? How can you make games that are active? And then if you take care of that and you sort of limit screens at the end of the night, then sleep is not a problem because you've worn yourself out. And so I would just start with sort of those primary pillars. Of course, if stress or sort of stressful parenting, we know that there are types of parenting that are sort of less stressful than others. We want to do the more authoritative parenting where we're both firm and loving. Then that can sort of really reduce stress in the family, reduce stress at bedtimes. So if I'm working with a family, it's going to be a lot of those conversations, like what does bedtime look like for the kids? What does it look like for the adults? Because role modeling is huge. There's so many families where we talk about, the screens are everywhere. And if the screens are the dinner table for the adults, well, no surprise, the kids are going to start fighting to have screens at the dinner table as well. So role modeling, walk through those pillars. How can we make this family friendly? And then just like the adults, start somewhere and move forward from there.
And I'll jump on that for a moment. So, in some sense, right, you're coaching the whole family, right? The lifestyle intervention is happening for the whole family. And, we see in brain injury, right, the role of the caregiver, typically a family member, can be really important. And so, as you're having these conversations about lifestyle modification across any age, how do you involve the caregiver, as you said, sort of that accountability partner? And do they need to be thinking about their own lifestyle modification, even if it's not in a parent-child relationship?
Yeah, I think it's very important that people around the patient, if they're making changes, the changes will come more naturally for the patient. I mean, whether that's a caregiver or a parent or a friend, having that kind of layer of, like we just talked about, connection of someone who's, or a teammate, someone who's willing and also striving to make some of these changes, will undoubtedly make it more successful for the patient. So I think that's where having these conversations in the clinic environment or in the hospital, asking who's your accountability partner, and that that draws from things like AA, where they have the sponsor. Yeah, I want to say support sponsor, and so yes, I mean it's very important that those folks can be involved.
Yeah, and if you're thinking about adults, right? So in brain injury, we're going to see young kids, teens, and so kind of Kim, your perspective on working with the whole family makes a ton of sense. And then we also see it spike up with older adults who fall. Mm-hmm. How would you mentioned silver sneakers and community-based programs like that, but are there other considerations that are unique to older adults as they think about lifestyle modification?
So it depends on the pillar you're talking about, mm-hmm. But I think just starting slow, small changes at a time. Knowing which, if the provider can know which programs are out there, like we mentioned, silver sneakers, and there's another program called Men's Sheds. They don't have them. There's not one here in Columbus right yet, but it's more of a men's community-based group where folks, older men, can get together and do different crafts and things together. So programs like that are really helpful. Loneliness is a huge problem for our elder folks. And so really working to improve that would kind of be one place to start. And I think a unique thing about older folks that isn't talked about much is actually strength. So actually having the strength to get up and get out of your house mm-hmm. and go do these things, go visit family. And so one of the pillars, I'm going through this with a family member of mine who is getting older, and I keep, trying to encourage actual strength training. And usually you want to start doing that with through either a physical therapist or a personal trainer. But really at any age, people can start doing strength training. Through lifestyle medicine, we recommend at least twice a week, and also balance training. And so mm-hmm. as people work on strength and balance, it makes it so that they're more confident to go out in the community. It makes it so that they're more likely to be able to keep grocery shopping, keep ending up at the coffee shop where they see the same person every day. And people can get stronger, even starting at 70, 75. If you can pick up a basic strength training program, people can get stronger and improve their ability to get out and engage with the community.
One of the great programs that we're a part of is called Walk with the Doc. And it was started by a cardiologist here in Columbus who was frustrated that he was asking his patients to exercise and walk after a heart attack, and they weren't doing it. So every Saturday he goes to High Banks and he started this walking program. And now there are hundreds of chapters around the world, including one we just added in Clintonville. And one of the best resources. It's completely free. It gets people their physical activity. It gets them out in nature, which we know is beneficial, but then also gives them supportive community. And we started it with a group called Village at the Ville in Clintonville, which is meant to get people and stay in their homes and really provide some community resources, whether that's handiwork in the house or helping get things done, helping get shopping done. Break down those barriers so they can stay in their home, but it also builds a sense of community in the neighborhood. So if you're in your home, that's great, but let's make sure you know your neighbors, that you care for your neighbors, that they, can come care for you. I think that's another way. If you don't have family close by or you're estranged from them, look at the people who are around you. How can you make friends with your older and younger neighbors?
So, we talk about, behavior change is hard. You're having these sort of collaborative, conversations and plans with your patients. And in some sense, we're talking about functional change, right, in their life, because that's what's important to them. So what would you say success might look like to a given patient?
I think, what's hard about lifestyle medicine is the timeline. People expect quick change, and I think we live in a world where people want to see change, on the order of days to months. And lifestyle medicine, while in some sense you actually can see quick change. If you go from a completely sedentary life to walking, X number of minutes a week, we actually can see your blood pressure go down relatively quickly. But to implement lifestyle change over months to years is harder to see for the patient. And so I think having that honest conversation about, this is habit change for the long term is kind of a really important place to start.
For me, I think at the individual level, success is not only hope for the future, that things can be better than they are today, but also really realizing that health is an absence of disease. There's a huge continuum of disease and health, and we want to move you towards health where you're feeling vibrant to do all the things you want to do. And you're not thinking about your health every day because you're just living your life. And as you age, that is a luxury that many people don't have. So that's what I want to see at the individual level and how I define success.
So lifestyle medicine, right? It's brand new to me. At one point, it was brand new to you. If someone is seeking this out, right, and it's either not necessarily provided in their care plan already, or maybe their PCP does not know about this yet, how do I get in contact? And also, what should I be evaluating in terms of what's a green flag in your lifestyle medicine provider versus a red flag? Any thoughts?
I'll take that one. So, there is a certification process. For physicians, you can become board certified in lifestyle medicine. For other health professionals, you can become certified in lifestyle medicine through the American College of Lifestyle Medicine. So I would first and foremost look for someone who's certified. And the ACLM does manage a directory so they can find someone in their areas. Here at Ohio State, again, Glenn mentioned we have inpatient consults if you're in the hospital. We can, we're getting the word out and getting into more and more places where physicians and APPs know that they can consult us. And then we have our outpatient telehealth and our group visit program. We have several websites that are trying to get the word out. But I would say wherever you are in the country, potentially in the world, go to the American College of Lifestyle Medicine's website to get started.
Okay. Easy peasy. And then we have a lot of audiences for this podcast series. So, we have people who have lived experience, right, and their care partners. We also have current and future providers. And then there's the general public. And oftentimes, brain injury is, important to educate on in any of those populations. How about lifestyle medicine? I mean, would you have specific messages for patients, future providers in particular, and the general public? What would you say?
Yeah. So let me speak to future providers. So starting at the American College of Lifestyle Medicine website, there's tons of resources. Even if you're just interested in what is lifestyle medicine, how do I get involved, what chapters are there in my community. Beyond that, if you're already in residency or you're a practicing physician or provider, there's two ways to go about the certification process. There's a lifestyle medicine residency track. Here at Ohio State, we have started that. So if you're a provider at Ohio State, get in contact with us, and we can start you kind of on a 2-year program to work towards certification. And if you're already a practicing physician for 2 years, then you can actually go right through the American College of Lifestyle Medicine and do their shorter certification process that's more of a 6-month to 1-year program to get certified. And
can I ask, could you be any type of physician and go into lifestyle medicine? Are there ones that are kind of tuned better?
I think, this is something that we didn't really touch on, but lifestyle medicine can touch patients at anywhere along their care continuum. I've met physical medicine rehab physicians, orthopedic surgeons, cardiologists, really anyone that sees patients can implement lifestyle medicine into their practice. And those could be physicians, APPs. There's even, physical therapists, you name it. there's a place in American College of Lifestyle Medicine for you.
How about for the patients themselves? I mean, in some sense, right? You're starting them on a difficult task, which is behavior change, and they have to be able to appreciate this. So, for a person that's out there that hasn't really ever considered this, what would you want them to know as a snippet?
Yeah, I would say that, lifestyle medicine, my favorite part about it is that patients, whether you have a brain injury or anything else, lifestyle medicine gives you a sense of agency, where sometimes it feels like medical care, you're out of control, you're a passive sort of participant in medical care. This allows you to be an active participant, as active as you want to be. So I would say ask your providers about it. More and more primary care physicians and subspecialty physicians are getting trained in lifestyle medicine, but perhaps you want to ask, is there a place I can go to get dedicated treatment from a lifestyle medicine certified provider, or one of the programs that's aligned with it, like exercises medicine or the diabetes prevention program, depending on your own circumstances. The other thing is that the American College of Lifestyle Medicine website, in addition to the directory, they do have patient-facing resources. So start there. They partner with a lot of other organizations that then can link out to. So if you can go there, kind of peruse around, and then I'm sure that there's a way to get involved or get in touch with someone from the American College of Lifestyle Medicine if you have questions.
Great. Well, we'll definitely make sure to get that website out along with the podcast so that people can refer to it. I guess in closing, right, so you both were practicing, you found this. Clearly, you're very passionate about it and believe in it. You mentioned a little bit about where it's going in the future, in terms of, how do you get the time to be able to have these conversations? How do you build around this? What do you see for the future of lifestyle medicine? And what would you like to see for the future of it?
What I would like to see is a world where when you go to your doctor's office, they're not just checking your blood pressure and your heart rate and your height and weight, but they actually check your lifestyle vital signs. Whether that's your primary care doctor, a specialty visit, we're asking patients these important questions about how are you sleeping, what's your diet like, what's your physical activity, how's your sleep, how's your connection with those around you. And typically we already are asking about, risky substances. But I think creating a healthcare system where we put lifestyle in the forefront and are encouraging those healthy habits, along the care continuum, and then secondarily using the medications that we know work and other procedural interventions and things as a secondary option, but really encouraging this behavior change and these lifestyle modifications at every touch point in the healthcare system.
The big successes in medicine are acute care medicine, whether it's treating infections or a trauma, for example, the emergency medicine care. But really, most of us, what we deal with day in and day out as any specialty physician is chronic care management. And so lifestyle medicine has a place there. I'd love to see it in medical education and health professions education more broadly from day one. We get a couple of lectures with the medical students, and we have an elective. We have this residency curriculum. Until it is embedded fully and reimbursed as such, there needs to be lifestyle medicine specialists that patients can go to and access, whether they be lifestyle medicine dietitians or lifestyle medicine exercise physiologists. At the system level and at the community level, success is where doing the healthy thing is the easy choice, where it's the default. And right now, that's not the case. It's a whole other podcast, but I would say, alongside all this individual patient work, we can't keep saying that, patients have to carry this burden by themselves. We have to actually advocate for systems, healthcare systems, school systems, workplaces, and sort of the community at large and our culture at large, where, it's natural to walk to places. It's safe to walk to places. It's safe to call on your neighbor when you need something. It's, making meals at home. People have time to do that again. There are a lot of barriers system-wide that truly to achieve success will need to address. But I think in the meantime, empowering patients so that they can get their own success and hopefully build it in their local communities is a step forward. But hopefully we get to a point where it's just part of routine care, like Glenn said, and providers have the time to do that with patients, for the patients to engage in their care, ask questions, and that it gets reimbursed properly so that it's not, a fail before it even starts.
Yeah, well, knowledge is power, right? And so getting the word out, at least to be aware of this practice, and that people are there to help you out with these the things that we always hear that we need to do, but struggle to really put in place. Well, this has been a fantastic conversation. I really appreciate learning all about what you do and the fact that you are doing it, and that it's a growing field. So, Glenn, Kim, thank you so much for joining us today.
Of course. Thanks for
Thanks
having
for
us.
having us.